And we're rolling.
Hey guys, Dr. Alex here. I hope you guys are healthy and well today. And in this video, what we're going to go over is what to do if you wake up and you have a crick or a kink in your neck and you can't turn your neck to one side. This is something we take care of in the office all the time. One of those things that, every once in a while a patient will, out of the blue, call up between the regular appointments and say, "Doc, I can't turn my neck." And at the office, we have a protocol that works really, really well. But because I can't see anybody in the office right now, I have to be able to give you some tools to use at home. So, in my experience, when this happens, usually at this point, everything is involved in terms of joint, muscle, nerve. So the root cause at this point doesn't really matter. In our office, we would take care of everything and try to fix the underlying problem. But in your case, you're going to have to deal with everything yourself. So first things first, if this happened to me, and this does happen to me every once in a while, if I couldn't see my chiropractor, this is what I would do. I would try and get the muscles and the nerves of the neck and the upper back to relax as much as possible. And what I would do is I would take a hot bath or a hot shower with the hot water coming down on the affected tissues for 5 to 15 minutes, taking nice easy breaths into the belly, really focusing on your breath, trying to let as much tension go from the body as possible. So we've jumped out of the shower, now we're going to try to start loosening up the tissues. And what I'm going to do first, before anything else, is I'm going to get down on my foam roller. And what I'm going to do is I'm going to start off by just lying on my foam roller like this, trying to put the entire weight of my neck on the foam roller for 5 to 15 minutes. Again. 5 to 15 minutes of taking really deep breaths, putting all the weight of my neck onto the foam roller. Before we get into a particular left or right side issue, we're going to just have it right in the middle here, trying to get the neck and the muscles and the stress response, the pain response, the pain spasm response to go down. So we're going to assume that I cannot turn my head to the right for this video. So what I'm going to do next is I'm going to turn a little bit over to the right and I'm going to start rolling the muscles of the neck. I'm at a 0 and then I turn to about, let's call it a 30-degree angle, and I'm going to start rolling the tissues of the neck as much as I can. And if I find a tight spot, I'm going to push down with my neck into the roller. Intensity, you'd want to ever be over 6 out of 10. Working through those tight spots where, especially if it's generating a headache or feels like the spot, that's where you want to be. I can also lower the foam roller down so I'm a little bit closer here to the trapezius muscle, and I can rotate over it or put my neck letting the neck fold over the foam roller and putting a little bit more weight into there. Now, you might have a little bit more success with a lacrosse ball, but the same principle applies. You're going to be a little bit more specific with the lacrosse ball, and you can get at different muscles or different tissues. Again, nothing more than a 6 out of 10 in intensity. Nice, easy, deep breaths. So I've rolled out the neck, and I'm starting to be able to move the neck a little easier. And what we want to do with this process is look in the mirror, and if you notice that you can only turn the neck here initially, but after some work in your shower you can turn your neck a little bit more, that's progress. In my experience, is if the objective outcome measures, like your range of motion, start to improve, the pain will dissipate later. You're not going to go from doing this to perfect in 15 minutes. It just doesn't work that way. You got to get the spasm to drop down and the pain response to drop down. But if you're doing a good job and your range of motion's improving, things will improve. So we've rolled lots, and we are going to move on to working on some of the tissues around the neck. So what we want to do is we want to take that same lacrosse ball, and we're going to find a wall or a corner, and we're going to work through this trapezius muscle here and find any trigger points or anything that might be stopping us from turning our head. So right hand side, I can't look towards the right. The right side is what we think is involved. That's where the pain is. So I'm going to put the lacrosse ball between the trapezius muscle and the wall, and I'm kind of pretending like my body's parallel. And what I'm going to do is one of three things. I can either press into the wall, onto the trigger point where it really is sore. I can move the lacrosse ball around by moving my body. Or I can hold the lacrosse ball and move my neck. So what I want to do here is I want to work through as much of that trapezius muscle as I can, trying to find any trigger points that might be stopping me from moving my neck. I found a really good one here, and I'm going to lean all my weight into that wall. Easy breaths. And then I can even go a little bit more inverted, and I can get here over the first and the second rib joints. So first vertebra here, second vertebra here, and then beside them are the first and second rib joints. And here on the first and second rib joints, I often find these tissues are big, either headache generators or often involved when somebody is torticolic and can't move their neck. And again, I can lean into the wall, I can rotate a little bit, or I can move my neck. Okay. So, two more things we can try if we're in this pickle and we can't turn our neck. So, the next thing we're going to do is we want to stretch out the trapezius and the scalenes. So to stretch out the trapezius and the scalenes, we're going to use our chair stretch. Grab onto the chair, lean the body, then lean the neck. 30 seconds to a minute, maybe even more if you can't turn your neck. With nice easy deep breaths. And this you are going to do both sides. Okay, and then so last but not least, we've got the finishing move. And so this is what I would do in the office if nothing else has worked with somebody. I've made the corrections that are necessary in their neck. I've done some acupuncture. This is my last hurrah, and it works, I'd say, 99% of the time. We've seen some good improvements from doing this at this point. So what we're going to do, I'm going to show you with my right hand because my left hand's a little indisposed. And what you're going to do is you're going to find your trapezius muscle. And you're going to grab the muscle, and you're going to grab it really, really, really hard. And you got to make sure that you're not here on any of the blood vessels or any of the nerves. This, I've got all muscle here, and I'm just going to slide my hand here a little bit deeper along the muscle. So muscle, muscle, I slide it, and I can grab that muscle right there. And doing this, it hurts like steak. And so what we're going to do, I've grabbed this trapezius muscle here. I'm going to turn my head. I grab it a little tighter, and then I'm going to slowly turn it to the right with a nice easy deep breath. So when I get to this position, it's starting to cause a headache or referral up to my head from the muscle being tight, from there being a trigger point. You're going to need to do that to yourself if you want to get your neck to be able to move. I go back to the left. I grab a little bit deeper and a little tighter. Oh, I can't believe I do this to patients. And I turn my head a little farther. Deep breath. and as far as I can comfortably or relatively comfortably go. And then I go back, I grab that same muscle again, turn my head to the right, easy breath, and go as far as I can. So, after grabbing that muscle, doing a few passes, almost certainly you're going to be able to move your neck farther. Now, this soft tissue maneuver, that soft tissue maneuver, be very, very careful that you're getting right on the muscle. Shouldn't have any numbness or tingling, shouldn't feel like you're going to pass out, and you definitely should feel like you're on the muscle here. That I would do on both sides, no matter what direction you are having trouble turning your neck. So guys, that's what I would do to myself if I couldn't turn my neck when I woke up in the morning or at any point throughout the day. If it doesn't seem to be getting better, try that process again. Or sometimes after doing that, your body just needs a little bit of a reset. Try having a lie down, try having a small nap, and often I find that gives the nervous system enough of a reset to make a big difference. In my experience, this works really, really well. Obviously not as good as if you can get somebody else's hands on you to take care of you, but until things change in the world, not going to be possible. If you have any comments, questions, or concerns, please leave them. I'd love to answer them and get back to you. Hope you guys have a great day. Stay safe, and see you soon.